Do you feel your heart racing unexpectedly? While occasional rapid heartbeat can be harmless, it may also signal an underlying health issue. Let's explore the crucial facts behind this alarming symptom to safeguard your well-being. A rapid heartbeat, or tachycardia, occurs when the heart beats faster than normal, typically over 100 beats per minute for adults at rest. While it can happen to anyone occasionally, understanding its common causes is essential for determining whether it requires medical attention. One of the most frequent causes of an accelerated heart rate is physical exertion. Exercise, especially high-intensity workouts, naturally raises your heart rate to pump more oxygen-rich blood to your muscles. This increase is expected and generally not a cause for concern. Similarly, emotional responses such as anxiety, fear, or excitement can trigger a faster heartbeat due to the release of stress hormones like adrenaline. Other everyday factors include the consumption of stimulants. Caffeine, found in coffee, energy drinks, and some teas, can increase your heart rate temporarily. Nicotine, found in tobacco products, and certain over-the-counter medications like decongestants, can also act as stimulants. Additionally, dehydration can cause a rapid heartbeat as the heart compensates for a lower blood volume by pumping faster. On the other hand, tachycardia can result from health conditions. Fever often causes an increased heart rate as the body works harder to fight off infection. Thyroid issues, particularly hyperthyroidism, can lead to a consistently elevated heart rate due to the overproduction of thyroid hormones. Anemia, where the body lacks sufficient healthy red blood cells to carry oxygen, may also cause the heart to beat faster to meet the body's oxygen demands. For some individuals, tachycardia is linked to underlying heart conditions. Arrhythmias, or irregular heart rhythms, can cause episodes of rapid heartbeat. Structural heart problems like heart valve disorders may also lead to increased heart rates as the heart struggles to maintain efficient blood flow. Recognizing these potential causes helps you identify whether your rapid heartbeat is situational or a sign of something more serious. Keeping track of your symptoms and their triggers can provide valuable insight for your healthcare provider. While a rapid heartbeat can occasionally be harmless, certain warning signs may indicate a more serious condition that requires medical attention. Recognizing these red flags can be critical for preventing complications. One key sign to watch for is persistent tachycardia, where the heart rate remains elevated even during rest. This can lead to symptoms such as dizziness or lightheadedness, indicating that the brain may not be receiving adequate oxygen. Additionally, shortness of breath or difficulty breathing, especially if it occurs without exertion, can signal that the heart is under stress or struggling to pump efficiently. Another concerning symptom is chest pain or discomfort, which may feel like pressure, tightness, or a burning sensation. While chest pain can result from various causes, its association with a rapid heartbeat raises the concern of a cardiac issue, such as a heart attack or angina. Fatigue or weakness, particularly when accompanied by a rapid heartbeat, may suggest that the heart is overworking to compensate for an underlying problem like anemia or a heart condition. Sweating, especially cold or excessive sweating unrelated to heat or activity, is another symptom that warrants attention, as it can indicate the body is in distress. Fainting or near-fainting episodes, known as syncope, should never be ignored. These episodes can occur when insufficient blood reaches the brain, possibly due to an abnormal heart rhythm. In some cases, they may precede a more severe event, such as a stroke or sudden cardiac arrest. Finally, if your rapid heartbeat is accompanied by swelling in the legs, ankles, or feet, this could point to fluid retention caused by heart failure. The heart's inability to pump effectively may lead to fluid accumulation in the body. If you experience any of these warning signs, it's essential to seek medical evaluation promptly. Early diagnosis and intervention can help address potential issues before they escalate, safeguarding your heart health and overall well-being. Stress and lifestyle habits play a significant role in influencing your heart rate. Understanding how these factors contribute to an accelerated heartbeat can help you take proactive steps to maintain a healthy heart. When you're stressed, your body releases stress hormones like adrenaline and cortisol, triggering the fight or flight response. This response causes your heart to beat faster as it prepares your body to respond to perceived threats. Chronic stress, however, keeps your heart rate elevated for prolonged periods, which can strain your cardiovascular system and increase the risk of heart disease. Lifestyle habits such as poor sleep patterns can also disrupt heart rhythm. Sleep deprivation leads to increased levels of stress hormones and heightened sympathetic nervous system activity, both of which contribute to a faster heartbeat. Prioritizing adequate sleep is crucial for allowing your body to recover and maintain a steady heart rate. Dietary choices, particularly the overconsumption of stimulants like caffeine and sugar, can temporarily elevate your heart rate. While moderate caffeine intake may be safe for most people, excessive consumption can lead to palpitations or prolonged periods of tachycardia. Similarly, diets high in processed foods and low in essential nutrients like potassium and magnesium may interfere with your heart's ability to maintain a healthy rhythm. Sedentary behavior is another major contributor. A lack of regular physical activity weakens the heart muscle, making it less efficient at pumping blood. Paradoxically, this can lead to an elevated resting heart rate over time. Incorporating regular exercise, particularly aerobic activities like walking or swimming, helps strengthen the heart and regulate its rhythm. Conversely, overtraining or engaging in high-intensity workouts without adequate rest can also result in an increased heart rate. Balance is key. Moderate, consistent exercise is more beneficial than pushing the body to extremes. Finally, unhealthy coping mechanisms such as smoking, excessive alcohol consumption, or substance use not only increase your heart rate but also contribute to long-term cardiovascular damage. Replacing these habits with healthier alternatives such as meditation or deep breathing exercises can significantly reduce stress and stabilize your heart rate. By addressing stress and making mindful lifestyle changes, you can help keep your heart rate within a healthy range and reduce the risk of long-term complications. An accelerated heartbeat or tachycardia can sometimes indicate an underlying medical condition that requires attention. Identifying these conditions is crucial for understanding the potential causes and managing your health effectively. One common condition associated with a rapid heartbeat is atrial fibrillation, AFib. AFib is an irregular and often rapid heart rhythm that originates in the upper chambers of the heart. This condition can increase the risk of blood clots, stroke, and heart failure. Episodes of AFib may come and go, or the condition may become chronic, requiring medical intervention to manage. Hyperthyroidism, or an overactive thyroid, is another frequent cause. The thyroid gland produces hormones that regulate your metabolism, and an excess of these hormones can lead to a consistently elevated heart rate. Symptoms of hyperthyroidism may include weight loss, nervousness, and heat intolerance in addition to tachycardia. Anemia, characterized by a lack of healthy red blood cells to carry oxygen, can also result in a faster heartbeat. In this case, the heart compensates by pumping more rapidly to deliver sufficient oxygen to the body's tissues. Common signs of anemia include fatigue, weakness, and pale skin. Another significant medical cause is postural orthostatic tachycardia syndrome, POTS, a condition where the heart rate increases abnormally when transitioning from lying down to standing. POTS is often accompanied by symptoms like dizziness, fatigue, and lightheadedness, particularly in younger individuals. Heart conditions such as heart failure or structural abnormalities like valve disorders can also contribute to tachycardia. When the heart's ability to pump blood efficiently is compromised, it may respond by beating faster. This is often accompanied by additional symptoms, including swelling in the extremities, shortness of breath, and persistent fatigue. Lastly, electrolyte imbalances in the blood, such as low levels of potassium, magnesium, or calcium, can interfere with the heart's electrical system and lead to irregular or rapid heart rhythms. These imbalances are often caused by dehydration, certain medications, or underlying health issues like kidney disease. If you suspect that a medical condition is causing your rapid heartbeat, it is essential to consult a healthcare provider for proper diagnosis and treatment. Early intervention can prevent complications and improve your overall heart health. While occasional episodes of a rapid heartbeat may not be a cause for concern, certain situations require prompt medical attention to prevent serious complications. Knowing when to seek help and understanding available treatment options can ensure better heart health. You should seek immediate medical attention if a rapid heartbeat is accompanied by symptoms such as chest pain, shortness of breath, fainting, or severe dizziness. These could signal a serious condition such as a heart attack, arrhythmia, or heart failure. Additionally, if you experience persistent tachycardia, even at rest, or notice that episodes are becoming more frequent or severe, it's crucial to consult a healthcare provider. Medical evaluation typically begins with a detailed history and physical examination. Your doctor may recommend diagnostic tests such as an electrocardiogram (ECG) to assess your heart's electrical activity or a Holter monitor to track your heart rate over 24 to 48 hours. Blood tests may also be ordered to check for conditions like anemia, thyroid disorders, or electrolyte imbalances. Treatment for a rapid heartbeat depends on the underlying cause. For example, if the cause is related to lifestyle factors such as stress, your doctor may suggest stress management techniques, including meditation, deep breathing exercises, or counseling. Reducing stimulant intake such as caffeine and nicotine can also help stabilize your heart rate. In cases where tachycardia is linked to an arrhythmia, medications like beta blockers or calcium channel blockers may be prescribed to help regulate your heart rhythm. If medications are insufficient, procedures such as catheter ablation, which targets and destroys small areas of heart tissue causing abnormal rhythms, might be considered. For conditions like hyperthyroidism or anemia, treating the root cause often resolves the rapid heartbeat. Hyperthyroidism may be managed with medications, radioactive iodine, or in some cases, surgery. Anemia treatment typically involves iron supplements, dietary adjustments, or addressing underlying health issues. In emergencies such as when tachycardia leads to life-threatening complications like ventricular fibrillation, advanced interventions like electrical cardioversion or defibrillation may be necessary. These procedures restore a normal heart rhythm and are performed under controlled medical settings. By understanding when to seek help and the range of treatment options available, you can take proactive steps to protect your heart and overall health. Early diagnosis and proper management are key to preventing complications and ensuring long-term well-being.